Licensed and Professional Treatment by Crystal Lynn. Cognitive behavioral therapy is a form of psychological treatment that has been demonstrated to be effective for a range of problems, including depression, anxiety disorders, alcohol and drug use problems, marital problems, eating disorders, and severe mental illness. Numerous research studies suggest that CBT leads to significant improvement in functioning and quality of life. In many studies, CBT has been demonstrated to be as effective as or more effective than other forms of psychological therapy or psychiatric medications. CBT is based on several core principles. These include psychological problems are based in part on faulty or unhelpful ways of thinking. Psychological problems are based in part on learned patterns of unhelpful behavior. People suffering from psychological problems can learn better ways of coping with them, thereby relieving their symptoms and becoming more effective in their lives. CBT treatment usually involves efforts to change thinking patterns. These strategies might include learning to recognize one's distortions in thinking that are creating problems, and then to reevaluate them in the light of reality, gaining a better understanding of the behavior and motivation of others, using problem-solving skills to cope with difficult situations, learning to develop a greater sense of confidence in one's own abilities. CBT treatment also usually involves efforts to change behavioral patterns. These strategies might include facing one's fears instead of avoiding them, using role-playing to prepare for potentially problematic interactions with others, learning to calm one's mind and relax one's body. Not all CBT will use all of these strategies. Rather, the psychologist and patient-client work together in a collaborative fashion to develop an understanding of the problem and to develop a treatment strategy. CBT places an emphasis on helping individuals learn to be their own therapists. Through exercises in session as well as homework exercises outside of the sessions, patients and clients are helped to develop coping skills, whereby they can learn to change their own thinking, problematic emotions, and behavior. CBT therapists emphasize what is going on in the person's life rather than what has led up to their difficulties. A certain amount of information about one's history is needed, but the focus is primarily on moving forward in time to develop more effective ways of coping with life. Art therapy. Art therapy involves the use of creative techniques such as drawing, painting, collage, coloring, or sculpting to help people express themselves artistically and examine the psychological and emotional undertones in their art. With the guidance of a accredited art therapist, clients can decode the nonverbal messages, symbols, and metaphors often used in these forms of art, which should lead to a better understanding of their feelings and behavior so they can move on to resolve deeper issues. Art therapy helps children, adolescents, and even adults explore their emotions, improve self-esteem, manage addictions, relieve stress, improve symptoms of anxiety and depression, and cope with a physical illness or disability. Art therapists work with individuals, couples, and groups in a variety of settings, including private counseling, hospitals, wellness centers, correctional institutions, senior centers, and even other community organizations. No artistic talent is necessary for art therapy to succeed, because the therapeutic process is not about the artistic value of the work, but rather about finding associations between the creative choices made and a client's inner life. The artwork can be used as a springboard for reawakening memories and telling stories that may reveal messages and beliefs from one's unconscious mind. Art therapy is founded on the belief that self-expression through artistic creation has a therapeutic value for those who are healing or seeking deeper understanding themselves and their personalities. According to the American Art Therapy Association, art therapists are trained to understand the roles that color, texture, and various art media can play in the therapeutic process and how these tools can help reveal one's thoughts, feelings, and psychological disposition. Art therapy integrates psychotherapy and some form of visual arts as a specific standalone form of therapy, but is also used in a combination of other therapy. Trauma-focused cognitive behavior therapy. Trauma-focused cognitive behavioral therapy is an evidence-based treatment approach shown to help children, adolescents, and their parents or caregivers overcome difficulties stemming from trauma. It is designed to reduce negative emotional and behavioral responses following trauma, including child sex abuse and other maltreatment, domestic violence, traumatic loss, mass disasters, multiple traumas, and other traumatic events. The treatment addresses upsetting beliefs and attributions related to the traumas. It also provides a supportive environment in which children are encouraged to talk about their traumatic experiences and learn skills to help them cope with ordinary life stressors, and helps parents who were non-abusive to cope effectively with their own trauma, own emotional distress, and develop skills that support their children. In the immediate as well as the long-term aftermath of exposure to trauma, including child maltreatment, children are at risk of developing significant emotional, behavioral, and other difficulties. Examples of these harmful effects can include depression, substance abuse, post-traumatic stress disorder symptoms, mood and anxiety disorders, suicide attempts, heightened cortisol levels, and involvement with the justice system. Appropriate candidates for this treatment include the following: children and adolescents ages 3 to 18 who remember being exposed to at least one trauma. Examples of these trauma can be child maltreatment, community violence, traumatic loss of a loved one, and who experience the following: PTSD symptoms, elevated levels of depression, anxiety, shame, or other dysfunctional abuse-related feelings, thoughts, or developing beliefs. Trauma-related behavioral problems, including inappropriate sexual behaviors, non-offending parents, or other caregivers. Interpersonal therapy. Interpersonal therapy is based on the common factors of psychotherapy, a treatment alliance in which a therapist empathetically engages in the patient, helps the patient to feel understood, arouses affect, presents a clear rationale and treatment ritual, and yields success experiences. Interpersonal therapy was originally developed to treat major depressive disorder. It is also used to effectively treat eating disorders, perinatal depression, drug and alcohol addiction, and other mood disorders, including bipolar disorder. Interpersonal therapy differs from traditional psychodynamic approaches in that it examines current rather than past relationships and recognizes but does not focus on internal conflicts. Interpersonal therapy builds two major principles. 1. Depression is a mental illness rather than the patient's fault or personal defect. Moreover, it is a treatable condition. This definition has the effect of defining the problem and excusing the patient from symptomatic self-blame. And secondly, mood and life situations are related, building on interpersonal theory and psychosocial research on depression. Interpersonal therapy makes a practical link between the patient's mood and disturbing life events that either trigger or follow from the onset of one's mood disorder. Treatment typically consists of individual sessions or group work completed within 12 to 16 weeks. Treatment is structured. including homework, continuous assessment, and interviews by the therapist. The first phase often involves 1 to 3 sessions during which the therapist will assess depressive symptoms and examine social history and close relationships, including any changes in relationship and pattern expectations. Then the therapist works with the patient to implement treatment strategies specific to identified problem areas. As treatment progresses, a targeted problem area might change. Acceptance and commitment therapy. Acceptance and commitment therapy, also known as ACT, teaches mindfulness skills to help individuals live and behave in ways consistent with personal values, all while developing psychological flexibility. Acceptance and commitment therapy helps individuals recognize ways in which their attempts to suppress, manage, and control emotional experiences create challenges. By recognizing and addressing these challenges, individuals can become better able to make room for values-based actions and support well-being. Acceptance and commitment therapy is based on relational frame therapy, or RFT, a school of research focusing on human language and cognition. RFT suggests that rational skills used by the human mind to solve problems may be ineffective in helping people overcome psychological pain. Based on this suggestion, acceptance and commitment therapy was developed with the goal of teaching people that although psychological pain is normal, we can learn to live healthier, fuller lives by shifting the way we think about pain. Acceptance and commitment therapy does not define unwanted emotional experiences as symptoms or problems. Instead, it works to address the tendency of some to view individuals who seek therapy as damaged or flawed, and aims to help people realize the fullness and vitality of life. This fullness includes a wide spectrum of human experience, including pain inevitability according to some situations. Acceptance of things as they come, without evaluating, attempting to change them, is a skill developed through mindfulness exercises in and out of session. Acceptance and commitment therapy does not attempt to directly change or stop unwanted feelings or thoughts. 6 basic principles form the foundation of acceptance and commitment therapy, and they are as follows: cognitive diffusion, expansion and acceptance, contact and connection with the present moment, the observing self, values clarification, committed action.